So I just spoke to my patient about what's been going on. We've taken the patient history and talked about things. Now I'm going to assess the wound. Just to show the camera, I just have my clean table space, and then I have my work area that just has my applicator and my gloves. So first thing I want to do is apply the gloves. As I'm doing that, I'm just looking at the location of the wound. So it is on the medial aspect of the right leg and just proximal to the medial malleolus. And I'm actually going to measure how proximal that is with my applicator. So I'm going to go ahead and measure from the malleolus to the edge of the wound. And my particular container for the applicator does not have a measuring tape, but I'm going to pretend like it is so I don't mess up my measuring tape. So distance from malleolus to the wound is 3 centimeters, so 3 centimeters proximal to the medial malleolus on the right leg. While I'm using my applicator, I will measure the size of the wound itself. So using the clock method, I will go check the length of the wound, so from 12 to 6. So again, using the measuring tape that came with the applicator, we have 6.5 centimeters. And I'll do the same thing for the width, so going from 3 to 9. And for the width, we have 3 centimeters. So I'm looking at the depth, and this seems to be a very superficial wound. I don't see much depth that I can be measuring, so I'm not going to measure it. I'll just take note of what the depth looks like. So before I go into the wound itself, I'm just going to check the pulses on the feet. So I'll start with dorsal pedis. It's a good normal 2+ pulse, and then posterior tib. Normal 2+ there as well. While I'm here, I'm going to check the temperature of the skin on the foot and near the wound. The temperature feels normal, and I'll go ahead and compare it to the other leg. Yeah, temperature feels normal. I do see some edema around the lower leg around the wound, so I'm just going to check for pitting edema and do a quick test. And we'll say that it took 10 seconds to return to normal, so I would say he has 2+ pitting edema. So now looking at the wound, I see it has a very obvious irregular shape as the wound edges kind of come in and then back out irregular. The wound edges itself are distinct, they are attached. The color of the wound, we see some red and yellow. I would say 80% red and 20% yellow. And we also have some black and purple around the peri-wound. Appears to be hemosiderin staining. And I also can see some dry, flaky skin, which might be indicating some dermatitis in the peri-wound as well. I do see some drainage coming from the wound. Looks to be moderate serosanguinous drainage with a yellow and red color that looks pretty thin. So also while I'm here, I would be checking for things like undermining and tunneling and things like that, and I don't see any undermining. I'm also going to be checking if there's odor coming from the wound, and I don't smell any foul odor. So I'm also looking for signs of infection, which I don't really see any. There's not a big change of color. I don't see abnormal drainage outside of the typical serosanguinous drainage I saw that usually comes with a wound like this, which I'm going to say is a venous insufficiency wound. I don't see any abnormal redness outside of the wound either, so I'm going to say no signs of infection there. And that concludes our evaluation. Thank you, Blaine.